Good afternoon, everyone. Thank you for joining us at the ACPJ's webinar, a mini webinar. It's not something that we've done before, but we would like to use the opportunity to try and clear the air with regards to vaccinations and COVID. For today, we've invited specially to speak to us Dr. Johan White, who's a clinical immunologist, and he's going to address some of the common misconceptions on the COVID vaccination availability, the reach of the vaccines in terms of the different populations, and some of the concerns about side effects that you may have. At the end of our discussion, hopefully we would have clarified some of the questions that you have, and we will give you an opportunity by providing a contact email at the end to send in your questions, which hopefully we can answer for you as we get them. So at this time, I'm going to turn over to Dr. Johan White, and he will guide us through the evening's proceedings.
Right. Good day, and thanks for having me. Thank you, Dr. Mills and the ACPJ for hosting this important forum. There is need for accurate information. There are competing sources of information and misinformation for the public. And so it's good that a reputable organization such as yours can be providing this forum to provide accurate information. I've found it useful when engaging the public or listeners or viewers to define what a vaccine is. You may be surprised that there may be misconceptions about what that word really means. And so I like to give a very simple definition in that a vaccine is an agent that uses a part of a germ or an inactivated or harmless form of a germ that is introduced into the human body in very small amounts with the aim of training your body or your immune system to recognize that germ and to be able to put up a fight in the event that you should come in contact with that germ in the future. It brings us then to the next question as to what exactly goes into these vaccines. And there's been many questions and concerns about new types of technology, or not so new actually, types of technology that on which the vaccines against SARS-CoV-2, severe acute respiratory syndrome, coronavirus 2, that causes the disease COVID-19. The main vaccines that are available against SARS-CoV-2, or we can say COVID vaccines now, include what we call mRNA vaccines. And in addition to that, the viral vector or adenovirus vector vaccines. We'll talk about the mRNA vaccines first. So mRNA stands for messenger RNA, and it's really based on genetic material of the virus, so the genes that come from the virus, in order to train your body or the cells in your body to make a component that looks like the virus. And then in doing that, your body identifies that foreign material or that germ and then puts up a fight. And in the future, when you do or should you come in contact with that germ, your body would have been prepared or trained to put up a fight. So if we think about the virus that causes COVID-19, SARS-CoV-2, I like to describe it as a ball with several spikes sticking off the surface. And this spike is very important. It is the first thing that usually would come in contact with your body. And the virus uses that to latch on to certain receptors or areas in the body in order to establish itself and cause an infection. If you can train the body, and it's that technology that is then, that vaccine is then introduced into the body, and your body learns how to use that genetic material from the virus and to make these spike proteins. The spike, the very important thing that the virus uses to latch on to your body to cause an infection. And therefore, your body is trained and learns how to recognize that spike and to put up a fight next time you come in contact with it. The other main type of vaccine that is available, the other type is, we refer to them as adenoviral vector vaccines. So that's a lot of words, but if you think of adenoviruses as common, usually harmless viruses, they don't usually cause disease or significant disease in humans, and they may affect other animals, such as monkeys or other types of animals. So you use that virus to basically carry the mRNA or the genetic material of the virus, the genetic material that tells your body to make spike proteins, right? Because remember, we're training the body how to recognize these very important spike proteins from the SARS-CoV-2 virus, or the virus that causes COVID-19. So these adenoviral vectors are like a little bubble or harmless virus that carries the genetic material of the virus to your body, instructs your body how to put up a fight, and you can protect yourself in the future. So those are the two main technologies. There are other vaccines that are available, and there are numerous vaccines being developed in clinical trials, maybe approaching 100, maybe more than that right now. But the front runners are the mRNA vaccines and the adenoviral vector vaccines.
Okay,
so currently the main mRNA vaccines that are available, certainly in Jamaica, that is a Pfizer vaccine, actually. There are others. There's another main one referred to as Moderna, which is available in other parts of the world, but as far as I'm aware, to date, not yet available in Jamaica at this time. So Pfizer and Moderna are the two mRNA vaccines, the main ones, and then the adenoviral vector vaccines include the AstraZeneca vaccine, as well as the Johnson & Johnson vaccine.
Okay. Would you say that the vaccines have been developed too quickly to be trusted?
Right. We've been able to conduct clinical trials in a way that sort of overlaps each other, because you're in a pandemic, you have to find ways to come up with a solution very, very quickly. So for example, in clinical trials, we normally would start with a safety trial. So you have healthy individuals, you give them the vaccine, and you are looking at safety in a very small number of persons. And then after that, you are now looking in another clinical trial, or the next step, to see not just if it's safe, but now you're looking at if it has a real benefit, if it is doing something in the body. When you give this vaccine that you're developing, does it lead to your body learning how to put up a fight? And you can measure that. We refer to that as the efficacy. So that's the next stage. And then after that, you would put it in a bigger clinical trial, now in which you're not only looking at your body's response when you get this vaccine, but you're looking at the effectiveness of that vaccine in protecting you from the disease of interest. So in this case, for example, protecting you from infection with the SARS-CoV-2 virus, or protecting you from hospitalization, or protecting you from deaths. So traditionally, we've had very clear stages between those clinical trials, with a pause in between to analyze the data and then go on to the next stage. And with regards to the development of the COVID vaccines, because of the emergent situation, they've had to, for example, combine some of those stages. So while you're looking at safety of a vaccine, you can be looking at whether your body is putting up the right response. So you, in a way, combine the first two stages, and then that allows you to jump right into a larger clinical trial now, where you're looking at the clinical effectiveness, or the ability of the vaccine to prevent what you really want to prevent, which is disease, hospitalization, and death. And in addition to that, another important factor that has contributed to the rapid development of these vaccines is just providing resources. This pandemic has posed a common threat to countries and peoples across the entire globe simultaneously. And so governments and decision makers and private sector and non-governmental organizations saw it fit to pool their resources and to ensure that resources are available for the development of these vaccines and conducting these clinical trials. Finally, I'll say that the mRNA technology, which people believe is a one-year-old technology, is not. This is something that scientists have been working on for over a decade, maybe 2 decades, in terms of trying to use a genetic material from a germ or a virus to train your body how to put up a fight against that germ. They've been using that technology to investigate vaccines or to develop vaccines against other diseases. And it so happens that that framework was available and they could readily switch out or put in the genes from the SARS-CoV-2 virus that causes COVID-19. So the technology has actually been there for several years. And we've just been very fortunate that in switching out the genes and putting in the SARS-CoV-2 or part of the SARS-CoV-2 or the COVID virus genes, we develop vaccines that work because.
Does the vaccine change our DNA?
Right. That is a common question. There's no evidence to suggest that a vaccine changes your DNA. The vaccines are made up of a small part of the genes from the virus, a very, very small part that's coding or leading to the development of the spike protein only or expression of the spike protein only. So it's not the entire virus. And so there's other important machinery from the whole virus that would be important if it were to try to incorporate its genes into the human genes. There are viruses that do that, and they do it in a way that requires many sophisticated molecules that come from the virus itself, and we don't have those available in the mRNA vaccine. So it's been shown in various clinical trials with persons who have been infected naturally with SARS-CoV-2 or who had COVID-19. When you take blood from those individuals and you look at the substances that the body produces to fight off the germ that we call antibodies, some people with natural infection will produce a lot. So they have high levels of really good antibodies to fight off the germs. And then other persons who have had natural COVID, natural infection and COVID, they mount antibodies or produce antibodies that are somewhere in the middle. And then a lot of people produce either very little or not enough. So in natural infection, it's very difficult to predict who will produce the right levels of antibodies and who will produce the right types of antibodies, because not all antibodies are really good at fighting off the virus that causes COVID-19. So in natural infection, you don't know who's going to produce the right levels and the right types of antibodies. One thing I'd like to add about natural infections is that germs or viruses are very, in a way, I like to say, very smart. When they get into the body, they also try to prevent your body from fighting it, all right? So when the whole virus gets into your body is going to try to attack it. And so the virus can counterattack by tricking your body to decrease the way that you're trying to fight the virus, or to decrease the amount of antibodies or other fighter molecules or fighter substances that your body is trying to produce. But when you give a vaccine, you're usually not giving a whole live virus that has that ability to trick your body into undermining its fight against the virus. And so you get a predictable protective response when you get the vaccines.
Can you say if the vaccine causes infertility?
Right. Common question. Very, very common question from both men and women. There's no evidence to suggest that these vaccines affect or negatively affect the fertility or reproductive organs of individuals. They've been demonstrated to be safe in women who are desirous of becoming pregnant or having children, as well as in pregnant women and breastfeeding women. And there have been no studies indicating any harmful effects on the male reproductive organs or ability to have children. So they are safe and they are not known to have any negative effects on fertility or ability to have children.
Do you know what the effects will be in a few years' time?
Right, that's a fair question, and only time will tell, because these vaccines have been in existence for maybe just under 2 years or so. And so we cannot say that certain events will or will not happen at 5 years or at 10 years after being vaccinated. Only time will tell. But for all medications or vaccines that are developed, ministries of health and governments have regulatory systems in place to monitor individuals for any negative short-term, intermediate-term, or long-term effects that may result. And there's an ongoing system to monitor individuals for that. So, the answer to those questions will come from what we observe over time. But so far, there is no indication that a negative effect on fertility is a problem with, or a problem that results from vaccination with COVID vaccines.
I've heard that vaccines cause blood clots. Should I take a vaccine if I've had a blood clot before?
Right. So there have been rare incidents of abnormal clotting of the blood in individuals, and it's associated with some vaccines more than others, right? So the adenoviral vector vaccines in particular have been shown to be associated with blood clots in a certain age group, so usually women around age 50 or thereabout, and it's very rare. So for example, for every 1 million doses or so given, there may be 2 or 3 cases of abnormal blood clots, for example. If somebody has had a history of abnormal clotting or blood clots or bleeding disorders, that is something to be discussed with their doctor, because the causes of blood clots may be different in different individuals. One of the things that we've observed with, for example, the adenoviral vector vaccines is a drop in an important substance in the body called platelets, which are responsible for the clotting of the blood. And interestingly, it's associated with a drop in platelets and an abnormal formation of clots, which can lead to complications. So, if somebody has had, for example, a history or a past incident of very low platelets, then those individuals, you would want to be cautious, but it's also important to consider those patients individually and what was the cause of the low platelets, for example. But fortunately, those complications or adverse events appear to be quite rare. For every 1 million doses or persons vaccinated, the number of cases of abnormal clots have been rare.
What about vaccines and high blood pressure?
Mm-hmm. There has been no association described in terms of vaccines causing the blood pressure to become increased. What we do know is that persons with high blood pressure are at an increased risk of having severe COVID and from dying from COVID-19. So persons with high blood pressure, as well as other underlying chronic medical conditions, are at increased risk for poor health outcomes if they do get COVID-19. So if somebody is hypertensive or has high blood pressure or diabetic or has diabetes or sugar, those persons really should be prioritized and really should be thinking about getting vaccinated as soon as possible to protect them from severe COVID-19.
What is myocarditis, and is it associated with vaccines?
Yes. So myocarditis is another adverse or unwanted side effect of vaccines in some individuals. So myocarditis refers to an inflammation of the heart, right? The muscles of the heart. And it's been observed in primarily young men. So usually late teens, mid-teens. And again, not a common occurrence. It seems to be more associated with the mRNA vaccines, than the other vaccines. And usually that individual would have certain symptoms like abnormal beating of the heart, may have chest pain, may have shortness of breath and other symptoms. And usually when managed promptly or treated promptly, those persons do recover and do fine. There is a major study coming out of Israel who have had a wide proportion of their population vaccinated with an mRNA vaccine, in this case, a Pfizer vaccine. And they've observed that, yes, indeed, these rare side effects of myocarditis or adverse effects can result from vaccination with the mRNA vaccine, especially in the age group that I described, young men. But what they have found is that the COVID-19 disease itself actually does cause myocarditis or inflammation of the heart. And it happens at a much, much higher rate in COVID-19, the disease, than you see for the rare complications or rare adverse effects with vaccination.
Should I take the vaccine if I have HIV?
Important question. So yes, it's important to be vaccinated. Persons with any abnormal immune function or weakened immune system are at risk for contracting the virus that causes COVID-19 and may be at risk for more severe disease. Persons who have HIV or other conditions that may weaken the immune system really should optimize their condition. So be on treatment, medications, taking them on time every day, and attaining a state where the virus in the body is at its lowest level possible on medications. And those individuals respond well to vaccination. They are shown to be protected by vaccination. Those persons who are not on treatment, who are not on medications for their HIV, are at risk of catching the virus that causes COVID-19. They may be at risk for more severe disease, and they also may not respond very well to vaccination because their immune system is not functioning in the way that it should when they're not on treatment. But persons with HIV or other immune compromised states or weakened immune system states should access or should get vaccinated. Patients who are on steroids are usually on steroids for the treatment of usually a chronic condition. Sometimes this is an immune system disorder where your body's immune system is in a way fighting itself. And so steroids are a way of suppressing or quieting your immune system. And there are a number of conditions in which that happens. For example, lupus, which is not uncommon in Jamaica. The amount of steroids that a patient is on will be an important factor in deciding when to get vaccinated. So if somebody's having a flare-up, so to speak, of their medical condition and is required to be on very high doses of steroids every day or for a long period of time, then they may not respond to a vaccine in the way other people would, right? And so they may not be protected from being vaccinated. And as such, those persons working with their medical doctor will be managed over some period of time until that flare goes down and until they're on the lowest amount of steroids that is required to control their disease or to keep their disease in check. And once that state is achieved, then it becomes, there's a better chance of them responding appropriately or mounting a protective response when they're vaccinated.
Should I get the vaccine if I have cancer?
Yes, you should become vaccinated if you have cancer or being treated or have been treated in the past for cancer. Cancer is also a form of immunocompromised state, in that persons with cancer may not have an immune system that is working optimally. And as such, those persons are at increased risk for contracting the virus that causes COVID-19 and at risk for severe disease outcomes. Again, like other persons who are immunocompromised or who have a weakened immune system, the concern is that they may not mount an adequate response or a protective response when they're vaccinated, if they're vaccinated in the same way that other persons are vaccinated. And so organizations like the United States Centers for Disease Control and Prevention do advise the use of an additional dose of the mRNA vaccine, Pfizer, for example, 28 days after their second dose in persons who are immunocompromised, just to get them to mount a protective response that is similar to somebody who does not have an immunocompromising or disease or weakened immune system.
Should I get the vaccine if I'm allergic to penicillin or another drug?
Right. Persons who have any history of allergies to or allergic reactions to medications or antibiotics have to be observed. And there is special caution in those individuals. And that's because in the vaccination development process, there may be the use of certain antibiotics to keep the manufacturing environment sterile or clean or free of germs, or to limit any contamination or germs getting into the vaccine development process. And so, there is theoretically, or there is a possibility that those persons could be exposed to trace amounts of certain antibiotics. But from large observation studies, observing a large number of patients who have had a history of allergies to different things, medications and different foods, they've been successfully vaccinated.
Can I take the vaccine if I have liver disease or kidney disease?
So yes, those persons with liver disease, kidney disease, or any chronic medical condition should be vaccinated against COVID-19.
What would be the number one reason for taking the vaccine, given all the uncertainties?
Even though the vaccines do protect us from infection, they do protect us from severe disease, they protect us from being hospitalized, they protect us from dying. So more than 90% effective in protecting us from dying and protecting us from being admitted to hospital. But for those persons who may still become infected, it just points to how important it is for us to continue to wear masks and to continue to avoid large gatherings, because you want to limit any opportunity for spread to other persons who may not yet be vaccinated, or other persons in your household or community who may be immunocompromised.
Suppose I miss my second dose. Should I still go for the vaccine?
Yes. If you miss or you're late with getting your second dose, get your second dose as soon as possible thereafter. And it's advised that you get the same vaccine, all right? So if you got your first dose of Pfizer and you were supposed to go back in 3 weeks, and for some reason, 6 weeks later, you didn't get the opportunity to go back for your second dose, as soon as you remember, it's important to arrange to get your second dose. It appears that for most of the vaccines, you may get a lower than required protection if it's done too close, but you tend to have a better response if the doses are spaced. In fact, spacing them even more has tended to provide better protection. So take, for example, the AstraZeneca vaccine. Initially, the recommendation was to give the 2 doses 8 weeks apart. And then from the clinical trials and observations of vaccinated persons, we realized that the protection was better if the doses were spaced 12 weeks instead of 8 weeks. So, you can infer from that that maybe 13 weeks may be a little bit better than 12 weeks, etc. But you want to stick to the recommended regimen. But if you are late on getting your second dose, you should just get it as soon as you remember.
Were the vaccines tested in all populations?
Mm-hmm. The vaccines were tested in adults primarily, and then those trials were subsequently extended to younger age groups, including persons 16 to 18, and then 12 to 18. And there's no data available just yet on any clinical trials in persons below 12 years, right? So in terms of age groups, the vaccines have been tested in a wide range of age groups, including the elderly. And the elderly are usually not in most of the clinical trials, certainly for vaccines. And scientists or persons working on developing the COVID vaccines recognize that the elderly are at extremely high risk of getting COVID-19. And so it was important to be deliberate in including elderly persons in those clinical trials. Other populations that have been included in these clinical trials include persons with chronic medical conditions like high blood pressure or diabetes. And again, that was informed by the observation that these persons are at extremely high risk of getting COVID and from dying from COVID. And so it was a deliberate effort to have these persons included. Persons with certain medical conditions like immunocompromised states or weakened immune systems. For example, persons with HIV were included in these clinical trials. However, we've seen that this has been in really small numbers and not necessarily by deliberate design. It's more of looking back at your data and seeing what number of persons had HIV and how they did, right? And the vaccines have tended to be good enough in individuals who are being treated for their medical conditions. In other words, they're disease has been under proper management and controlled, and therefore their immune systems can function as normal as possible, and they can put up a protective response when given these vaccines. A population of special interest includes women of childbearing age and pregnant women. So even though these clinical trials excluded persons who were pregnant, there are data on persons who became pregnant during the clinical trials. And those persons were observed and followed up and have not been found to have any adverse events that were more than would be observed for other participants in the clinical trials.
Which one is worse, the vaccine or COVID?
The COVID is worse, right? We hear of is worse than any side effects that you can imagine from getting the vaccine. We've heard of different side effects that vaccines may cause, and we know that they're very rare, like, 1 or 2 in a million, or, depending on the condition, a few for every million doses given, and usually treatable or can be managed in a health facility. COVID, however, can affect not only the airway or the breathing passage, but it affects any part of the body: the brain, the blood, the kidneys, the heart, and the risk of any of these complications or adverse effects that you can think of for the vaccines, it is a lot higher for COVID-19, the disease. So COVID-19 causes strokes and heart attacks, right? It causes abnormal blood clotting. COVID-19, the disease, causes myocarditis. COVID-19, the disease, causes pericarditis or inflammation around the heart. COVID-19, the disease, causes kidney failure. COVID-19, the disease, kills also, right? So COVID-19, the disease, is a far greater threat to any individual than the protection that you can get from the vaccines. And so it is wise to protect yourself, but also protect your loved ones, because one of the things that I've noticed from persons that I've had to be educating about the benefits of vaccines and why it's important to be vaccinated, they may not necessarily be quick to accept it for themselves, but when you do remind them of their loved ones at home, your toddler, your baby, your child, your parents, your grandparents, do you really want to take the risk of taking home a germ to them that could be deadly for them, even more so for them than you? And that has really made an impression on some individuals, and they really do think about that. But I think, it's really important for all of us to get vaccinated and to protect ourselves, protect our families, and to see how best we can get back to as normal as possible in terms of our daily lives.
Thank you very much. And finally, is there anything else you'd like to say?
Right. I'd like to say that persons should feel free to voice their concerns and questions about vaccines. Gone are the days when a healthcare provider could just say, take this, and the patient is mum, and they just do as you say, right? I believe people are more informed and really just have questions that, your parents would have, my parents would have, and you try your best to see why they have that thinking and to see how best you can provide accurate information and from accurate and reputable sources. And usually that is empowering for individuals. Individuals, it would appear, feel a need to want to arrive at the decision to become vaccinated, like on their own volition or on their own terms. And they don't necessarily want to feel forced or ridiculed. And they really should be allowed a forum with their physicians, with healthcare providers, with public health professionals and other scientists to just have their concerns voiced.